taken the responsibilities that we bear of intense public interest and the faith and confidence that the public of England have in the National Health Service befits that we should consider issues affecting its funding, its future and its transformation in a public setting. But just two caveats to that. The first is that we will be conducting the principal business of the meeting in this public setting, but always there are confidential items that we need to take in a private meeting at the close of the public meeting. And secondly, to stress always, of course, that although this is the high point of the conduct of business by the board, we do a lot in other forums. We do a lot in committees. There will, at the end of today's formal agenda, be some reports from committees. And I would highlight particularly a new committee, the Commissioning Committee, that met for the first time yesterday under the chairmanship of David Roberts, and he will be making a report to us today on the business that they were able to transact. A couple of days ago, we had a meeting of the Task and Finish group on congenital heart disease. We will be bringing to the July board a paper that has been worked up over an extensive process of public consultation. Yesterday, the board met with the NHS citizens and participated in a session with them here in Leeds yesterday afternoon, which I think I can say on behalf of all of the board we found exceptionally interesting. It helps us to get away from some of the high-level issues of funding and trying to drive change and to actually engage with, not just listen to, but engage with people who are having a daily experience of the services that the NHS provides across the country and to work with them around issues of improving service and co-design and actually working through with them a number of issues that they had raised with us last September at our AGM, and we were able to report on what progress we'd made, where there had been success, where there was disappointment, and what our commitments were for future development. We also spent some time yesterday afternoon in what we call a development session, which is the board in informal session, thinking about the longer-term strategic issues, particularly actually in the really tight funding settlement that we've got for 2015-16 and what will be the priorities and how we'll address them. We'll come back to some of that in the course of today's meeting when we review the principles that will underline our business plan for next year. So that, I hope, gives a sort of contextual picture of the way in which the board operates. So I've always been very keen to ensure that this wasn't a board which at a formal meeting received proposals that had been worked up by the executive team, subjected them to cold scrutiny and then dispatched them. This is a board that works together as a team across the whole business. Okay, just one final issue, which is to say that we have been experimenting for the last couple of years with producing our board papers in electronic format. So you'll see board members referring to iPads. These contain the full board papers. They're not being used for Angry Birds or any other illicit function. When board members' eyes are fixed on their screens, they are totally focused on the business of the board. Right, I hope that's clear. Now, let me please then declare the meeting formally open and move into the formal business. To say that there is no fire alarm scheduled in this building this morning, and if the alarm does sound, we will evacuate the building and we will be led by our team. Secondly, I'm going to invite board members to declare any interests they may have in specific items of business on the agenda. I need to declare in relation to item 7, which is genomics, that I am a board director of Genomics England Limited. But just two things about that. First of all, that's a company wholly owned by the Secretary of State for Health to carry forward the 100 Genomes project. And secondly, I am not NHS England's representative on the board. As a board director, my responsibility, my fiduciary duties are to the board of Genomics England, but my presence on the board is, I think, a valuable way of balancing the quite complex partnership that we, NHS England, have with Genomics England. Are there other declarations of interest? Moira?
I should just I'm the chair of Skills for Care in relation to the adult social care paper.
Thank you. There are no other declarations of interest. I have no apologies for absence. This is a full house, and indeed we will be complimented during the morning by David Pearson, who is the president of ADAS, and Caroline Downs, chief executive of the Local Government Association, who will speak to the paper on social care. The handling of business, we will probably take the 2 items of committee reports that are formally on the agenda as starred items, unless in the course of the meeting anybody indicates that they would like to open those items. But the report from the commissioning committee I will take as a full item of business. Right. So we then turn to the minutes of the last meeting, and I would like to invite the board to signify their approval of the minutes. Thank you. I have no matters arising that aren't otherwise on the agenda. Anybody else? No, thank you. Then please may we move on to the report from the Chief Executive. Simon, over to you.
Thank you, Malcolm. And I would first of all just like to thank all of the staff of the National Health Service who were involved in NHS Change Day 2 weeks ago, which was a fantastic mobilising of energy and optimism, dare I say it, on the part of tens of thousands of nurses, junior doctors, therapists, porters, other staff across the health service, all of whom were identifying things that they could see they wanted to change in their part of the health service, making commitments to do so and taking action on the back of that. And I think that's a good corrective to the understandable pressures that everybody is under, and a sense of real ability to reshape services, which is obviously what we're going to need over the period ahead. I spent the day with a nurse called Andy Tyso from Countess of Chester Hospital, and he gave me my Dementia Friends training. And then I spent part of the afternoon with a group of people with learning disabilities and their families, and met a young woman who had been living in institutional care for years, but she came to show me her video of her sailing in the Solent as a result of having taken control, personal budget for those services. And I met another woman called Jean Riley from Yorkshire, who described the massive impact on the care of her daughter, that being able to take more control of the health and social care that she had. And in fact, I was so impressed with what Jean Riley had to say that I took her with me the very next day to a speech I was giving to the Royal College of Physicians in Harrogate, and we did a double act together. And she explained precisely how care can change on the back of the, frankly, revolution in the balance of power that has occurred. So those are great sources of optimism. Huge thanks to all of the frontline staff involved in NHS Change Day. Turning or changing gear a little, as we think about the current position in the National Health Service, later on the agenda we'll have the report from Barbara describing the current pressures, performance. We are obviously at a point in the annual cycle where providers and commissioners, CCGs, NHS England, working out what's the appropriate way of squaring the circle between funding and investment and activity and improvement for the year ahead. No doubt that this is going to be a complex task over the next 4-6 weeks. Everybody using best endeavours to do the right thing for patients in their local communities. Over the Easter period, looking out for April, we have asked, we being ourselves Monitor, the Trust Development Authority, that CCGs continue to fund all of the extra services that were in place over the winter period through April, while the Better Care Fund kicks in and the contracting round is concluded. But I think we can't avoid the fact that there clearly are very substantial cost pressures which have been building in hospitals over the course of this year, and I think that has to be a call to action on the part of the NHS collectively going into the new year. What I think it clearly shows is that the single biggest cause of pressure has been the big increase in extra staffing, particularly agency staffing, temporary staffing. And what that shows is that a combination of a fair national pay system, but then leaving individual employers to try and hire temporary staff by themselves, that combination is not working, in that it has produced an overspend of £697 million across just the foundation trust sector in the first 9 months of this year. So that tells us something very important about how we've got to change our approach to managing the workforce of the National Health Service, and it tells us something very important about how we are going to deliver on the efficiencies, the broader efficiencies, the 22 billion or so, that are going to be required whoever turns out to be the next government. So this collective action issue is something that NHS England, together with our partners in the other 5 national leadership bodies of the National Health Service and employers across the NHS, are working on intensively now. I suspect we're going to need to take a radically different view to things like setting maximum rates for agency staff, employees over the course of the next 6 months or so. That's the sleeves rolled up conversation we have to have. It will be better for quality of care. The RCN themselves say that there is enough funding to potentially convert that spending into more than 20,000 permanent nurse posts. That's the job of work that we've got to now engage with our partners across the NHS on. Looking more broadly at the 5-year forward view agenda, we've made really quite substantial progress on kicking off a number of the active ingredients that are going to be needed for success. We've got a paper later on in this meeting, Malcolm, on the first 29 vanguards, the energy on the part of the many hundreds of groups of nurses and doctors who came to talk at the Oval for 3 days, debate what the future looked like. I think it was a source of great encouragement and inspiration. We have, with Public Health England, kicked off the first national diabetes prevention programme, which is obviously not going to solve our health or financial problems next year, but is an important start to a broader programme of taking prevention seriously. We've got a discussion later on this morning on health and social care, again with the integrated personal commissioning, bringing together health and social care budgets for individuals, and the in-principle agreement to move in that direction in Greater Manchester. I think NHS England is showing the seriousness with which we are taking action on that agenda. And then today, in respect of the innovation agenda, we are, together with the Office of Life Sciences and the Department of Health, kicking off the worldwide call for innovators and entrepreneurs who want to come and use the NHS as a test bed for improvement, so that we can potentially be, we're never going to be the healthcare system that pays the highest prices in the world, but we ought to be the place of the destination of choice for people wanting to try new innovations that produce a good payoff for patients and for taxpayers. This week we have also launched the Mental Health Task Force, which, as prefigured in the forward view, will help us chart the key priorities for mental health improvement and parity of esteem over the next 5 years, similar to the process we've kicked off with cancer under the leadership of Harpal Kumar. And today we are announcing the membership of the maternity review team that we, at the time of the Morecambe Bay inquiry, said would be required in order to review the UK and the international evidence on responsive and efficient maternity services, ensuring that women get safe and appropriate choices and that staff are supported in the provision of that care. We're asking Baroness Julia Cumberledge to chair that review panel, with Sir Cyril Chandler as the vice chair, and then a wide cross-section of interests and expertise, including neighbourhood midwives, consultant midwives, the National Child's Birth Trust, Mumsnet, the Royal College of Obstetricians and Gynaecologists, the Royal College of Midwives, James Titcombe, who is a bereaved father from Morecambe Bay, has also kindly agreed to serve as a member of this panel. So high expectations, important work to be done here on all of our behalf over the course of the rest of the year. And then finally, and we will talk about this in a moment, I know, Malcolm, our business plan for the year ahead, we expect, subject to the board approval today, to be able to publish that tomorrow. The last thing I just should say, by way of a piece of sort of important process, as it were, for the National Health Service, is obviously we're about to go into the election period, and it's entirely legitimate that and desirable that in a democracy there should be vibrant debate on the future direction for the National Health Service. All of us working in the NHS obviously recall the standard guidance that applies to the National Health Service over this period of time. Decisions on whether to permit visits to NHS property are, of course, the responsibility of the individual NHS providers, but there shouldn't be disruption to services, and the same facilities should be made available to all candidates. But election meetings should generally not be permitted on NHS premises. So those standing rules kick in the moment that Parliament is dissolved, and the reality, of course, is that we go into this election with the NHS having a plan for what the future needs to look like, a widely agreed game plan with a lot of agreement on the type of care redesign that is going to be required, a clear proposition to whoever is the next government: give us the tools and we will do the job.
Well, thank you, Simon, on that high note. May I invite members of the board to raise any queries or comments on the Chief Executive's report? No, well done. Thank you for that, and indeed, much of what you've presented, we're of course going to be coming to in the course of the meeting. Right, thank you very much.